Hello viewers and welcome to today's edition of our program, The Health Center with Ozion Atkunye. And here is your regular host and anchor, Ozion the Expressionist. And your favorite platform here, The Health Center with Ozion Atkunye. Yeah. Welcome. Today I'm bringing you the topic tonsilolate. Yes, you might wonder what's this tonsilolate. It is simply tonsil stones. And you may have been familiar with the word tonsillitis. That's different from this. Tonsillitis is different from tonsilolate, but they are interconnected somehow because tonsillitis can cause you tonsilolate. And like I said, tonsilolate is the tonsil stone. But first of all, what is tonsil? Tonsil is that muscle or tissue you find just directly as I open my mouth. In fact, open your mouth and you see what I mean. Bring out your tongue and look backwards at the back of your throat. You will see two muscles that drops down like bags. Very small, tiny muscles that are there. That sometime when you are growing up, you may have felt inflammations or pains in that stuff that comes from top towards your tongue. Yes, that's exactly what I mean. It is just like the color of your tongue. When that place becomes painful to you and this kind of swollen, it's called, and it's swollen and still remains that kind of reddened color, it's called tonsillitis, which means an inflammation. And severally we have discussed inflammation on this platform. And what is inflammation? When your immune system is fighting against certain foreign agents or diseases or bacteria, virus, whatever, and then in the cause of it, inflammation manifests. But why is it affecting that tonsil? Because tonsil is a part of the immune system, and mostly it affects the children. Why? Because children have growing or developing immune system, unlike adults or the younger ones, the teens, whose immune system have grown better than them. However, it does affect teens as well and some adults. Why? Because they may have had or they are having immune system that are not as strong as it's supposed to be. Where when bacteria comes into their body, especially through that route of their aura, their mouth, if it traps them because it's meant to be filtering bacteria or whatever foreign material that is coming, when it now comes to filter any kind of this bacteria or virus, and that one tries to overpower the immune system, then the inflammation comes. And in the cause of the inflammation growing up, it is now known as tonsillitis. When this happens in some people, it still keeps attracting of trying to filter some other, and the thing grows bigger. While growing bigger, some minerals in your body that come to you through your mouth will begin to deposit there because they have found where to land or rather occupy. When there is this kind of deposition of materials, that thing is called stone. Yeah, it becomes a stone when it has deposited there. So that deposition of certain materials in that lump is called tonsilolate, or as well as tonsil stones. So this is actually what this means. So this tonsil stone can be found in many people. Many people can suffer this. And when it is there, it becomes a problem because it comes with certain symptoms that discomforts the person. What are those symptoms you see? The person will suffer pain, but first of all, to identify this tonsilolate, the person suffers bad breath. What do you mean by bad breath? Bad mouth odor. Imagine that. Have you had somebody who is suffering from this kind of condition? You might not, but know it. Now, when it smells sometimes, it is not just that person. Whenever that person has it, not only that can cause somebody's bad breath. Bad breath in medical time is known as halitosis. Halitosis is the odor that comes from the mouth, and it could be a cause from this particular disease condition we are talking about now, the tonsil stone. And it could as well come from different other disease conditions. So when you see someone who is having this, it means that there are some other conditions that you might have to not just sympathize with the person, but suggest to the person some other treatments, like I would mention. But we are not going into details of those other ones. But for you to know that certain conditions, such like, of course, poor oral hygiene is number one that can cause you poor bad breath. What again? Gum disease known as gingivitis, that is the inflammation of the of the gum, of course, that can cause you mouth odor. What else? Extensive buildup of plaque. Yes, certain kind of plaques, the thing decaying and the building up of it in gum can cause you this halitosis or bad breath. What else? Health conditions. Someone who has cancer, cancer of the throat, cancer of the ear. You remember when you talk about the ear, neck, and throat connected? That can as well cause you bad breath or halitosis. What else? So somebody who is suffering from this particular condition now, tonsil stone, which is what we are treating now. Somebody who is suffering from GERD, known as GERD, gastroesophageal reflux disease. Of course, the breath from the gaseous and the whole mixture can as well suffer from bad breath. Yes, halitosis. What else can cause you this? Liver disease and as well as diabetes. All this can make someone suffer from bad halitosis. But typically here, we're talking about the one, tonsil stone. The number one symptom, bad breath. What other symptom does this person really have? The person suffer from cough, suffer from earache, suffer from sore throat, and suffer from bad taste, of course. So with all these, you know that, oh, this person has this, possibly it's this. But are you gonna do something? Of course. What are you gonna do? There is no typical medication for this person. In as much as the symptoms can be treated, like the cough can be treated with cough drugs according from the whatever the doctor prescribes, or the pains, or the earache, of course, which is the pain. Another thing that has to be done this time is that that has to be known this time is that this condition can resolve on its own. Yes, it can resolve on its own. You may not even have to treat it for a long time or treat it at all. But you have to do something to manage it before it goes. What? The bacteria, the materials, they have to go off. How do you do it? Warm water, gargling with warm water. Rinsing your mouth with warm water with salt. Warm water with salt can get this deflated and take away the bad things that are there out of your mouth. And you will become better. Yeah, after some time, not just one. Do it consecutively doing this. You'll be finding the relief. What of brushing your mouth? Of course, you know that. You have to be brushing your mouth just to get everything that will be finding way to accumulate in that sack. Take them out. Sure. What other thing would you want to know? Staying hydrated. Water drinking, of course, is very important. When you do this often, it will be able to help you. And take away everything that dislodge into your mouth, then that would help. So, this tonsilolite is something that, like I said, can resolve on its own and as well can be treated, especially the symptoms, depending on how it is affecting you. The earache, the cough, the sore throat can as well reach to the extent that the doctor would try to know what actually is the cause of this sore throat and give you antibiotics, or whatever prescription that the doctor gives to you. But then, like I said, it can resolve on its own. So, what is tonsillitis and how can it cause this? Tonsillitis can as well cause this tonsillitis because when you have this inflammation, it can turn to tonsilolite because it has given way after inflammation that causes, which is the tonsillitis, to gather the materials that occupy there. Another thing that is very important is that in tonsillitis, its inflammation turns red. But in tonsilolite, which can now, after the red, even if it is from tonsillitis, causes you a yellowish or whitish color. So it could be pus. It could be just that white, yellow color, showing that has become several materials like calcium, whatever mineral mixes up with this. Another thing you need to know if you're a smoker, smoking actually makes mouth odor very well. And it's another thing that can cause you halitosis. Another thing that can cause you halitosis is autoimmune disease, like the Sjögren disease, Sjögren syndrome. Yes, which really affects the muscles of the body and a whole lot of that has to do with this. However, I wouldn't like to take you too long about this, but I want to entertain your questions. Someone might ask, what's the importance of this tonsil? I have explained that, and when it is cut off, because this is part of the immune system, like I said, but when that is cut off, it doesn't mean that your immune system won't be working again. No, your body can still work very well while when your tonsils are cut off. Tonsils protect foreign materials that come through the mouth, but still, remember that your immune system in this particular microbiota area is still very much active to defend your entire body from anything that happens. Let's stop here for now, but I expect to see more questions and I will continue to engage you. But what matters is that you know your body and keep doing the best for your health, of course. It's wealth. Thank you and have a great day.